Welcome, everybody. I'm Dr. Mark Nelson, and I'm really excited to be doing a webinar with two incredible women who are both registered dietitians who you'll learn about really quickly in just a few minutes. What we're going to share with you today is a very powerful opportunity for you to be able to create health for your patients, friends, family, actually a whole lot of people if you wish to, and at the same time create more options for yourself. So here we are. I'm here with Nancy Taylor and Janet Blum. Nancy, how are you today?
I'm doing great. Thanks, Mark. Glad to be here.
Fantastic. Well, we're thrilled that you're here. Would you share a little bit about yourself?
I'd be happy to. Again, my name is Nancy Taylor, and I'm a registered dietitian of 20 years. I have been in private practice for 10 years. And what I found with that is with obesity-related diseases and the obesity epidemic, I found that to be a challenge in my practice. And so about 5 years ago, I was looking for a good program to bring into my practice. And at the recommendation of a nurse, I actually discovered Take Shape for Life, and very happy that I did. Number one, I have started it as a tool that I offer my clients. With the success on that, I'm actually looking to go full-time with that. But what I found also with the program is it was my go-to for obesity related diseases such as diabetes. So the outcomes are very predictable. I can support people from 10 pounds to 100 pounds plus. And what I love is that it is not a diet and exercise program. We do focus on mindfulness, and we are a comprehensive program.
Wow, Nancy, thank you. And are you having fun with this?
I'm loving it.
Wonderful.
I'm loving the success, and I love happy clients.
Yeah, and that's important. Janet, how are you doing today?
I'm great.
Wonderful. Would you share a little bit about yourself?
Sure. So I've been a dietitian for 34 years, and like Nancy, I was actually introduced to Take Shape about 5 years ago by a dietitian colleague of mine. And at the time, I was seeing primarily patients with complications of obesity, as I think most of us are. And I was actually finding that there were a lot of barriers to success, and I'm sure a lot of you can relate to that. We weren't really getting much success with regards to weight loss and changes in health. And so as I started to coach Take Shape for Life, my passion for what we do increased greatly because I started to really see changes and really get results. I started sharing and coaching colleagues, family and friends, and people in my own life. And totally unintentionally, at first, my coaching business actually really grew. And again, I fell in love with it. You know, suddenly I was seeing a success rate of 100% for those who were truly ready to change. And that was a big difference in what I was actually seeing in my practice with typical medical nutrition therapy alone. So I felt like I finally found what I was meant to do all those years, and that was assisting people to transform their health. And then 14 months later, I decided to coach full-time, and I've never looked back. I've been really honored to be able to assist hundreds of people to create health in their lives with Take Shape for Life, and I'm actually honored to be able to share with you all tonight.
Wow, Janet, thank you. You know what I hear from both of you is, which is really important, is you know, as excited as we are or were about going into healthcare in terms of whatever avenue we took, me as a cardiologist, you as RDs, what we all have in common is we feel like we're in a better position to help people with this program in many ways than where we were. And so my story, and that is just so powerful, my story is I've been a health coach with Take Shape for Life now for 9 years, almost 10 years. And, you know, I was a busy cardiologist and seeing a lot of people who were overweight, obese, a lot of prescriptions, a lot of diseases. And I discovered with this program, I was actually able to help people get healthier and get off medications and get rid of diseases. And that's not something I had ever been able to do before. And it really got my attention, and my patients were so grateful. And I was grateful, and I realized I was getting paid to help people get healthy. And Margaret said, you know, maybe you should do more of this because it's always been what you've wanted to do. And that's my wife, Margaret. So where disease was the center of my universe before, now it is health. And that's what we're going to tell you about. We're really excited about it. So who is Take Shape for Life and Optavia? So we are health coaches. We're a professional health coaching service, and we get paid to guide people to health. It's really pretty amazing. We come from all walks of life. 20% of us are healthcare professionals like myself, like Nancy, like Janet. And the other 80% are people who've discovered Take Shape for Life, usually through their own personal journey, and simply have decided to help others and pay it forward, which is pretty exciting. Now, we are transforming into Optavia, which is a whole new brand and offering and premium product line of fuelings, which we're going to share with you. So our future is very bright, really exciting, and we're going to share that with you as well.
So what Take Shape for Life offers clients is what we call the trilogy of optimal health. And we believe that when these three areas are all in balance, we get to enjoy optimal well-being. So when one area is out of balance, it can affect the other areas. But just for myself personally, it was the financial piece that was way out of balance. And that actually, affected my sleep, and it affected my stress levels. And maybe some of you can relate to that. When those are out of balance, it can affect your eating behaviors, and your moods. So I think you can see how one area would affect the others. And so when we coach clients, we really like to take a look and help them to take a look at all three areas and see the relation of the three. So one of the great things about this for myself was that I was able to actually turn around my financial health to a place that it's actually never been before. And so with that, the healthy mind piece got better, and even the healthy body. So we aim to be right in that smack in the middle, that sweet spot of well-being.
Yeah, which is pretty cool. And how about you, Nancy? Did you want to add anything here?
Yeah, sure. In addition to coaching, which clients can very well choose to join us in coaching. But the other aspect with healthy finances I wanted to point out is that some of our clients, they're so empowered and their confidence has improved that their performance on the job actually improves. Mm-hmm. And so they've actually, we've had some that have actually received promotions even and improved their finances. So it goes well beyond just a healthy body and healthy mind.
And one of the things I just want to emphasize here, and you've all represented it really well, is the fact is our health and well-being in the world is about all these things. And the interrelationship is very important, because you don't see the word diet on this slide, because that is not what this is about. This is about really helping people transform, improve, strengthen the very fabric of their life and their being. And that is really extremely important. And actually, that is what health is really about. It's far more than the absence of disease. Having said that, and as RDs, and you all are well aware of the fact that this is the epidemic of the century. It's the epidemic of our time: overweight and obesity. 70% of Americans, in fact, half of all adults in the United States, have diabetes or prediabetes. And the great thing is that as a coach, we have a very powerful program and opportunity to really reverse this trend. And we all see it. We see it all around us. I know both of you, Nancy and Janet, have generated many referrals from healthcare professionals, from doctors and others, because of the power of what you're doing here. Would you share a little bit of that with our audience?
Well, I think that many physicians do refer to dietitians, but as dietitians, we know that our results are not staggering. So when physicians find out about this comprehensive lifestyle program with a weight loss component, and they see their patients coming back with truly, wonderful results, they're excited, and they're more inclined to continue to refer to us because we really are getting the results. And so I think physicians are looking for something because, I'm partnered with an orthopedic office who was sending, they needed their clients to get to a certain weight so that they can actually perform the surgery. They had to bring the BMI down. So what did they do? They were sending them to bariatric surgeons. So they were thrilled to find out that they can send them to a health coach who has a program that's, that's medically created and works.
Janet, I agree with you. I also am, because of the outcomes, I'm also getting physician referrals. And again, orthopedic surgeons who are looking for a way to produce outcomes because they cannot move forward with surgery, or they're planning ahead before they have to reach that point of surgery. And I actually had one client recently who came from that referral source that had gone through so many different programs, as people so often do. And and she's been successful so far, but the key point is it was hope for her, that she had been through so much, and now she knows that she can do that because she knows she can work on the mindset and actually see the transformation.
And the other thing, because I've had a similar experience that's really amazing, is just in terms of referrals from other healthcare professionals, and obviously as RDs, you're in an extremely powerful position to reach out to those individuals, is you also see staff in the offices getting healthy, and the healthcare providers themselves getting healthy, and they're having more and more interest in what you're doing because they are up against this epidemic as well. And we also get referrals, of course, from successful clients who refer people. So this business grows organically just by helping people.
So I'm sure many of you have seen this chart, and as RDs, we already know how obesity affects disease. I just want to say, as the difference as a health coach is, because we're using a program, I'm sure you're all waiting anxiously to hear exactly what this program is, and we're going to get there. But because our results are so predictable and so good, we get so much joy from coaching because I am really having people, constantly telling me about decreased pain and inflammation, about coming off of different medications, lowering their diabetes medications, sometimes coming off. So, the feedback is so great, and it's something, again, that we always knew was possible, and that's partially why we went into dietetics. But as an RD, I really didn't get that joy that often, and here we're just seeing it, so much more frequently. So we really are seeing the healing effects of weight loss. So this is a story about Karen. Karen's one of my clients. I actually met her at the gym, and in that first picture, she was 308 pounds and really working out like a fiend. I never saw a woman 308 pounds working out the way this woman did. It was pretty incredible. She was strong, and she was actually pretty fit. But Karen couldn't lose any weight. She was 2 hours a day. She told me that her metabolism was destroyed because she had quadruplets, and during that entire pregnancy she was unable to eat, and so her metabolism was just destroyed, and that she was really only eating 1,500 calories a day, and this is what her life was going to be for the rest of her life. So it took about a year, but she ended up coming on board and trusting us and trusting the program, and Karen ended up losing 152 pounds over the next 18 months. Some of the behavior things that she realized is, yes, she was eating 1,500 calories a day, but she was actually eating it all within, maybe like a 3-hour period in the evening. She was going all day without eating. And, as we know, that's puts you into fat storing mode. So the program really taught her new habits. It really helped her to address her emotional eating. It really inspired her husband, who had type 1 diabetes and ended up coming on board and losing 28 pounds. But more importantly, he actually reversed his retinopathy. So, Karen ended up getting a job at the gym, and so many people saw her transformation that, they saw not only her body transforming, but her mind and her attitude and really everything about her that came along with it. And she decided to actually come on board, and she's now been trained to help to coach others. She's not a dietitian, but she's a coach, and she's just helping to guide and assist people awaken up their own desire to create health and be able to move them through the program so that they too can create health and she can stay accountable to her own health journey.
I mean, and look at that, look at that smile on her face, right? And she has shared this, as you know, Janet. So many people can relate to her and say, "Wow, you did this. Help me, show me how."
Well, Mark, I'd like to share the story. Now, this one is actually a personal story that I wanted to share with you, because we see things professionally, but we don't really know the impact. But when it really hits you on a personal level, then you know what professionally our clients are actually achieving and those around them. And this is the story, transformation story actually, of my mother. And this is Murtis. And she weighed in about 260. She had been losing weight prior to coming on our plan, but she stalled. And so she was motivated by basically an increase in medication. She wasn't feeling good. Her movement was very minimal. And so that life was not one of quality. And, all of us around that love her, we were very concerned. But she actually made the decision to make a change. And so what we have is 120 pounds later. Yes, she lost weight, but that is not the story, really. The story is the quality of life has improved and the huge mindset. She developed what we talk about here. Gradually, she started working on habits of health. And so now she has all of habits of health in her lifestyle. She focuses on movement, healthy eating, and healthy sleep are her key points. And she's just joined a gym, and she walks a mile a day with my 83-year-old father. So what I want to really focus is that it's at any age people can improve their lives and live healthier, longer lives. So I'm delighted to share that story.
Wow. I mean,
and Nancy, you have been a dietitian for 20 years and you weren't able to help her, right?
I know. I did the thing that you really don't do is you don't nag. And so what I did was live by example. Once I came onto the program and was actually improving in front of her eyes, then she got the confidence that she could do this as well. And that's exactly the results.
Yeah, and helping people create a healthy mind, right? That's so. Look, these are they're just incredible stories. So really briefly, and you all know this, sick care is not health care. It's not a criticism of me. I was in the sick care system for many years, or anyone here. It's the structure. The structure is simply really not working because we're paid to and trained to react to and treat and manage disease. We're simply saying we can also create health. I mean, the FDA recently approved a stomach pump for weight loss. That's not a joke, by the way. Seriously, this is pretty scary, where people dump stomach contents in the toilet, right? And by the way, there are 4 billion prescriptions written a year in the United States, 13 per American, man, woman, and child. 13 prescriptions when you average it out. We can do better. That's all we're saying. We can do better by helping people get healthy and really moving beyond sick care to real healing. And our bodies can heal. And I'm sure all of you know as well that in truth, 90% of type 2 diabetes and prediabetes, 90% is preventable and reversible. We know this, and we can actually help people improve their health and get rid of many diseases and medications. And people can do that by losing weight, learning healthy habits, changing their mindset. Most of the chronic diseases that we've referred to as chronic, we can have a great impact on, which is really exciting for us as coaches, as health professionals, and certainly for the people whom we help. So we are really moving healthcare, if you will, into the third era. And we'd love for you to help us because there are so many millions of Americans who are struggling. The first era was the era of communicable disease. The second era is the era of chronic disease, diseases that in fact are usually chronic because we simply have failed to address the root causes, which is what we do consistently. So we work with people one by one, and we simply move them onto a new health path. And we're going to share what that path looks like right now.
So what we do, this new path, is the Habits of Healthy Living that is focusing on healthy bodies and healthy minds. I think in our 2 transformation stories, we've shown what we do. We do focus on healthy weight, healthy eating, healthy motion, but so often we don't include healthy sleep and healthy stress reduction. And so those are really key points to bring in because we know they're deal breakers in creating healthy bodies. But the true point, again, demonstrated in our transformations, is the healthy mind. And helping people get the mindset right, because once the mindset is right, the healthy body will follow. And these are the 4 pillars of our program. And each client receives their health coach. And so this is a personal one-on-one guide in moving their life forward. And so we're with them on the entire journey. I do want to point out that clients do not pay us. The company actually pays us to support our clients. The Habits of Health is a scientifically proven lifestyle approach designed by Dr. Wayne Anderson. Our Optavia community is what I feel is just a vibrant, supportive community, and I think that really shines for me. It's meant a lot in my life and in our clients' lives. And the community is a virtual community. But we also encourage our clients and ask them, who are those around you that want to get healthy with you? And so they build their own support system as well as a support system virtually. And so we have a lot of support tools there, such as Habits of Health, doctors' calls, nurses' calls, and a phenomenal nutrition support team. And the healthy fuelings that we have, again, scientifically proven, and full, complete nutrition, and Janet will show us that.
Yeah, and just to mention on this slide, the health coach is just such an important piece because a client has this one person in their life who's there, knows why they want to get healthy, knows why it's important to them, and is really just there to help work with them, walk with them through this journey. And it's, you know, I've had clients say to me, it's all about having that health coach. When I can text you at a weak moment or with a question or whatever, I'm there for them. All I care about is their success. Their success is what's giving me joy. And so that health coach piece is just key. I mean, all of these 4 pillars are key, but I just wanted to kind of mention that. And then if we go to the next slide, we're going to talk about the fuelings. So, you know, we're talking about all these wonderful results, and how does it happen? How does it actually happen? The magic is our eating plan, and I call it the magic because it's so simple for people to follow, and the results are so predictable. And the best part is that they don't feel like they're starving. They feel really good, and they're seeing results. One of the problems, I think, when I was working as a dietitian in practice is people would lose interest. You know, they're trying to make these changes and, you know, they're not really seeing success. It's a slow go. So with this, the results are quicker, which just brings them on board to want to learn all of the other pieces because they are feeling so good so quickly. So we have our premier plan is called the Optimal Weight 5-in-1 plan. And it's a structured eating plan, simple to follow. We use a combination of food from the grocery store and our portion-controlled meal replacements. The meal replacements are they're all the same macronutrient wise. So they all have the same calories, protein, carbs. They're an excellent balance, almost a 1-to-1 ratio of carbs to protein. They all have 20% of the RDA of 25 vitamins and minerals, and they have they have the fiber that you need. They're low sodium. So it's really a dietitian's dream as far as what they consist of. Optavia is our premier line of a new 13 products that all are all natural with no artificial ingredients. They're non-GMO. They have probiotics added. So whether they're using the original meal replacement fuelings or these or mix and match, the bottom line is they're on this 5-in-1 plan. They're eating every 2 to 3 hours. They're getting the same amount of carbs every 2 to 3 hours, about 15 grams. Their blood sugar's staying steady. They're getting into this habit of fueling their body every 2 to 3 hours. They're eating one meal a day that they can either create on their own and eat with their family or eat out in a restaurant. And we call that the lean and green meal. And this is 5 to 7 ounces of protein and 3 servings of low-carb veggies. So with this, they're learning to create that one healthy meal. They're able to socialize or eat with their family, and they're not totally overwhelmed by creating 6 meals a day. This is the one meal, and because of our community, we share recipes and ideas for this meal. So they're already starting this new habit. So with the 5-in-1 plan, after the first 3 days or so, they use up their glycogen stores in their liver, and they start to break down stored fat for energy. And the benefit of that is they feel great. They're not suffering with any physical hunger, and they have an increase in energy. So this very mild fat burn works so well in their favor because now they feel great. And again, they're preserving their lean body mass and their muscle, and they're breaking down stored fat for energy. So it's a healthy weight loss. Did you guys want to make any comments on that?
I mean, you covered it. One comment I think, and this is something that has struck all of us. I know 9 years ago, I wasn't as healthy as I am now. And I did the 5-in-1 for a lot of reasons, but it was with my busy life, it was the easiest thing in the world to do, and that's the other thing in our chaotic, crazy world. We make it just so easy for people to really start to walk down a new path.
Yeah, I mean, it is simple because the meal replacements are portable. But the other thing is it takes a lot of the thinking. It takes a lot of the thinking out, which is really important at first, because then we can focus time with clients talking about, triggers and the mind pieces. We can take the focus away from the food. The fuelings are the fuelings, and we can teach them about fueling your body. And that's what we're doing. We're fueling your body every 3 hours, giving it just what it needs, and now allowing you to sort of focus on behavioral things and the other pieces. So that's what I love about it. I mean, and as a dietitian, I'm comfortable because I know they're getting all their fiber, they're getting low sodium, they're getting all their protein. I know that they're getting really good nutrition while the results are happening. It's excellent positive feedback for both them and us.
That is so important, and I know Nancy is going to share a little here, but this understanding that the fuelings are the catalyst for long-term change. This is the long-term change we're talking about, right, Nancy?
Absolutely. And it's really our clients, they're seeing results, and then they start making daily choices. And it's really on day one that they start making is step-by-step processes. And so they're able to choose habits of health and actually, and away from the habits of disease, like Linda Sue did here, and transform her health and actually take control of her health and her future. Speaking about controlling the future, we do look out that far. So these are the steps that we're on with our clients. So I really want to point out that, diets usually stop at step 2, where you reach a healthy weight, and then your clients are like, what now? And so they haven't learned what changes have I actually made, what changes can I actually live with that I will continue to live with and move forward. And so that's where we come in and do our best work. Step 3, actually transitioning them. And learning those habits of health and that mindset to create what they want to create.
Yeah, so we just to mention, we have a specific transition plan. They don't stay on the 5 and 1 forever. It's temporary, and then we transition them to like step 3 is transition to healthy eating, and then they may or may not use some of the fuelings as part of their daily diet, as so that they can continue to eat every 3 hours, and that'll be up to them whether they want to use those fuelings or use the fuelings, you know, from the grocery store.
This is very important to me. We've seen diabetes research on which diets actually work, quote unquote. And this study is actually done at Johns Hopkins University, Bloomberg School of Public Health. And it's comparing our portion-controlled meal replacements to that of a standard American diabetes diet that is self-selected. And a year into this, what they actually found is there's a greater weight loss and less regain on the portion-controlled meal replacements. And not only that, but there's an improvement in insulin levels and glucose levels, hemoglobin A1C, and blood pressure. So very good outcomes with that. And actually the recommendation is diabetes educators can actually look at portion control and how they may fit in as recommendations to their clients and patients.
So while people are losing weight and on our structured eating plan, they provided with this Habits of Health curriculum, and this is almost like our health Bible, and people can use this along the way. The Living a Longer Healthy Life is a workbook where they can actually write in, there's lessons, and it goes along with the Habits of Health. And what I love about this is people are in educating themselves, where they're empowered to educate themselves to work on their own triggers and behavior loops and things like that. So, you know, not everybody's going to read this as a cover-to-cover thing, but it's an amazing resource. There's chapters on sleep. There's chapters on healthy activity. There's actually, you know, recipes in the end, and exercise moves that people can actually do at home, and if they're you know, brand new to exercise. So this is our curriculum, and with the first, you know, month of fuelings comes this curriculum that they can use, and people do really well, because they're, again, being empowered so that they are prepared for coming off of the meal replacements, coming off of the 5 and 1 plan, and moving along as they optimize their health.
And the other thing I just want to emphasize, because it, you know, as a cardiologist, I found I had to teach a lot of things to people, and I love doing that. That, however, can take some time. We're mostly people's guides. You know, the teaching is really in the program. It's a lot of it is, you know, self-study, if you will, and self-realization. And so you really brought that out really well. You know, both of you have in your comments. As a guide, we can really, you know, also focus on what the most important things are for people.
Yeah, and you know, a healthy body begins with a healthy mind. We all know that diets are temporary solutions, and as health coaches, we're actually trained to empower our clients to become mindful of their choices, and to really just to understand that their thoughts and their habits are really at the core of their behavior. And you know, if you don't work on this mind piece, the results are usually not permanent. So this is just, you know, I think we've made this clear that it's just so much more than a diet. Again, part of our training with the health coaching really focuses on talking about the mindset and talking about how we're in control of our thoughts. So I think that piece is what I've learned a lot from that piece, maybe more than I actually had as a dietitian. So I love that, because we all know that this is the key.
Janet, what I wanted to mention, you know, as dietitians, we work a lot with mindfulness. It is a great tool to get our clients looking in that direction. But what I find with our program is that they're just so successful doing, you know, they first start with healthy eating. And so it's so easy to work with them on the healthy mindset.
Yeah.
So let's talk a little bit about health coaching, which is pretty exciting. So just a few important points, and Janet and Nancy chime in at any point. So as a health coach, you're the CEO of your business. You're your own boss. That's very important to understand. Some people like having a boss, some don't. But in this business, you're your own boss, and you have people to work with you and help you and guide you, but you decide what you want to do with it. You have freedom and flexibility. You can work anywhere, anytime. You really just need three things: a passion to help people improve their health and well-being, a phone, and a computer. This work can be done from your home, from your office, at a beach house. It could be done on vacation, because we're always meeting and talking with people, many of whom have challenges in their life, and we can help them address many of those. We're rewarded for helping others, which is a wonderful thing. And there's no inventory and no territories. So we don't sell anything. And I'm not saying selling things is bad. I'm simply saying we don't do that. We certainly have tools and resources that our clients can avail themselves of. But we don't carry inventory, which makes this very simple, especially for practices. And there are no territories. And what that means is that as a health coach, you can help anyone in the United States of America, Puerto Rico, the Virgin Islands, and Guam. And in the relatively near future, because of our transformation into Optavia, we will be going international, and that will be really exciting. By the way, there are no ICD codes, so we're not practicing medicine. I don't need malpractice insurance as a health coach. No health coach does. And we don't need to bill managed care. The company pays us directly to guide and help people. And I believe there are only 73,000 ICD codes today. Is that right? Well, we don't need any of them, thankfully. Again, you don't need malpractice insurance. Now, when I was practicing as a cardiologist, I obviously did need malpractice insurance because of the care I was giving people in the context of being their doctor. But as a health coach, it's not necessary because we're not practicing medicine. We're simply helping people get healthy, which is a lot simpler and a lot less complicated. And again, this can be office-based or home-based. You can do this business part-time or full-time anywhere that you want to, which is, of course, really nice. There's a great deal of flexibility.
Mark, I also wanted to point out in that last slide, because I still do medical nutrition therapy at times, I still hold my malpractice insurance. So I just wanted to clarify that, since I'm not full-time health coaching.
Sure, thank you.
So to become a health coach, it costs $199, a one-time fee. You get a co-branded website, and you have a business sponsor who helps you to really helps train you to do this coaching of this program. We have a certification available for coaches for an extra $199, and our certification is an extra test to take. It's not that difficult, especially after what we've gone through to become a dietitian. But basically, we're certified through the Center of Obesity Prevention and Education, which is affiliated with Villanova School of Nursing. So that's available for all coaches. We coach as a team. So again, the business sponsor is there to assist you to get started, whether it's getting started bringing this into your practice or just doing it outside of a practice.
Yeah, and that's great because we all have support. We all have support that helps us, which is wonderful.
And so you can just see that we're paid well to help people. I think, we've already addressed where we get our clients, whether it's from our practice or, for myself, I've built this business at home and not in a practice. And what I've found is that, because the results are so visual and people feel so good, they are excited about it. And they're very, very often, they're referring their family and their friends. And again, because there's no territories, I have business all over the country. You get one person in California and they're referring their friends and neighbors and families. So then you start building pockets of business all over the country. So, you know, the stories of Karen, Karen and of Nancy's mom are just examples of where we find our clients, just people in our lives.
Janet, I also want to state from a private practice perspective, still the largest part of what I do is through my daily life, who I know, who I work with, etc. But in addition to that, in private practice, definitely, you know, physician referrals, but it's also who normally is contacting us with daily inquiries. And a lot of dietitians in private practice, you may know of Health Profs. I actually have information out on Health Profs, and that actually drives you know, business to my practice, as well as people seeking a healthy weight. So just wanted to chime in there.
Well,
Thanks,
thank
Nancy.
you. And you know, one of the things that's important to recognize is that we can also, if we choose to, build a health network and work with other coaches. So these average monthly incomes on the right, they're very real. In fact, they're pretty conservative. And the reason that we share this is it's a model that's actually very similar to the current, you know, healthcare industry model. So let's say you're a doctor or an RD or a PA, or you're in an office with one or two health professionals. If you want to help more people from that perspective, you can hire and bring on many more people. So now you may have 10 or 20 or 30 or 40, 50 doctors under one roof. And in fact, that's happening a lot in medicine today, as we all know. Well, we do the same thing if we want to, except, you know, we're not anyone's boss. It's really a matter of people who say, I believe in what you're doing. Can I be a part of what you're doing? And because we have team coaching, we sponsor and work with other people and help them help people they know. So that can be pretty exciting, because you can, if you choose to, not only coach clients, but also coach coaches and help colleagues and other people, help other people where they are. We all know this is a national epidemic, and the consequences of this epidemic are far-reaching. So I'm not going to go into this in detail. Certainly you can reach out to the person who invited you for more information about financially what's possible, but quite frankly, there's no ceiling, and you can build as small or as big a business as you choose to, working with clients, working with coaches, or both. It's pretty exciting. A health network is the different structure and system, very different, of course, than the sick care system. We also encourage people to visit optavia.com. It's a very exciting, it's very exciting, and this website is very exciting. It's really the future that we're growing into. And so please check it out. It's really amazing, and the premium fuelings, as Janet shared with you and Nancy, are also fantastic. So we want to thank everyone for being on this webinar. We hope that you found it helpful and informative. Please follow up with the person, the health coach who invited you to this health professional webinar. I want to thank Nancy and Janet for being two amazing women RDs and health coaches who are moving the health of America forward. And in the process, they've really enhanced their own health and well-being, as I have. And believe me, that's a good thing. I was extremely stressed out as a cardiologist, and I'm a lot happier now. And I think it's fair to say that Nancy and Janet are as well. So thank you both so much. You're just amazing. And thank you so much for sharing your heart and your passion. And thank all of you for being on this webinar. Have a wonderful rest of the day.